morning, students. So we will start with the next class. So the next topic that I will be taking, it is malabsorption syndrome. So what is this malabsorption syndrome? So malabsorption syndrome, it is a general term. Okay, so malabsorption syndrome, it is usually a general term which is used to describe a number of clinical conditions. Okay, malabsorption syndrome, it is usually a general term which is usually used to describe a number of clinical conditions. Okay, which is used to describe a number of clinical conditions in which one or more nutrients are not absorbed properly. Okay, one or more nutrients are not absorbed properly in the GI tract. Okay, it is not absorbed properly in the GI tract, and thus excessive loss of nutrients in the stool with increased fecal contents. Okay, thus excessive loss of nutrients in the stool with increased fecal contents. So what is that malabsorption syndrome? So malabsorption syndrome, it is a general term which is used to describe number of conditions. Okay, it is a general term which is used to describe number of general conditions or number of clinical conditions in which one or more nutrients are not absorbed properly or inadequately absorbed by the GI tract, and thus excessive loss of nutrients in the stool with increased fecal content. Okay, with increased fecal content. So what is that malabsorption syndrome? It is usually a general term which is used to describe a number of clinical conditions in which one or more nutrients are not or inadequately absorbed in the GI tract, and then it is usually where there will be excessive loss of nutrients in the stool along with fecal content. So this malabsorption syndrome occurs in the children who cannot properly absorb nutrients, vitamins and minerals from the food. Okay, you are not able to absorb nutrients, minerals, vitamins from the food. Okay, it occurs in those children who are not able to absorb nutrients, vitamins and minerals from the food. So malabsorption syndrome, so it is usually a term, general term which is used to describe a number of conditions in which one or more nutrients are not properly absorbed in the GI tract, thus allowing excessive loss of nutrients in the stool along with fecal content. So this occurs in those children who are not able to absorb nutrients, that is minerals and vitamins from the food. So that is usually about this malabsorption syndrome. And this is what is malabsorption syndrome. So malabsorption syndrome, it is a general term which is used to describe a number of clinical conditions. Okay, which is used to describe a number of clinical conditions in which one or more nutrients are not properly absorbed in the GI tract, and then it is usually excessive loss of nutrients in the stool along with fecal content, and this usually includes it affects those children who are not able to absorb nutrients, that is vitamins and minerals from the food. So this is usually about this malabsorption syndrome. So next is causes of this. So what might be the causes? So there are various causes for this malabsorption syndrome. Okay, they are not single one or two causes, but there are various causes which causes this malabsorption syndrome in the children. So it is mainly due to, one by one we will see what are the causes of this malabsorption syndrome. So in that, first is due to infective agents. The first is due to infective agents, such as if the baby is suffering from intestinal tuberculosis, HIV infection, or gallbladder and pancreatic diseases, or in case of lymphatic obstruction. Okay, the first cause for this, it is due to infective agents. Okay, it is due to infective agents. So that usually it includes it can be due to intestinal tuberculosis, or it can be due to HIV related diseases, or it can be due to gallbladder and pancreatic diseases, or in case of lymphatic obstruction. Okay, or in case of lymphatic obstruction. So that is usually there. And next is due to structural defects. Okay, it might be due to any structural defects, such as in case of inflammatory bowel disease. Okay, this can occur in case of inflammatory bowel disease, irritable bowel syndrome, as well as post-gastrotomy or gastrojejunectomy. Okay, it can also occur in post-gastrotomy or gastrojejunectomy. So that is usually seen in that it may be due to structural defects. Okay, it can be due to any structural defects. So that is usually in case of inflammatory bowel disease. Okay, in case of inflammatory bowel disease, or in case of irritable bowel syndrome. Okay, in case of irritable bowel syndrome, or in case of post-gastrotomy or gastrojejunectomy. It can occur due to post-gastrotomy or jejunotomy. So these are usually the causes of this malabsorption syndrome due to any structural defects. So next is due to mucosal abnormalities. Okay, it can be due to any mucosal abnormalities such as celiac disease, Crohn's disease, fructose malabsorption. Okay, it can be due to celiac disease, Crohn's disease, or due to fructose malabsorption. So that is usually due to mucosal abnormality. So next cause, it is due to enzyme insufficiency. Okay, next cause, it can be due to enzyme insufficiency. It can be due to lactose deficiency, sucrose intolerance, or in case of pancreatic enzyme insufficiency. It can be due to lactose insufficiency, sucrose intolerance, or it can be due to pancreatic enzyme insufficiency. So that is usually due to any enzyme insufficiency. So next is due to any other systemic diseases. Okay, it can be due to occur any systemic diseases which affects GI tract, such as diabetes mellitus, hypothyroidism and hyperthyroidism, or it can be due to cystic fibrosis and in case of celiac disease. So that is the next cause. It is due to any systemic diseases that usually affects GI tract, that it might be diabetes mellitus, hyperthyroidism, hypothyroidism, celiac disease, as well as cystic fibrosis. So these are usually the cause that is due to any systemic diseases. Okay, it can be due to any systemic disease that is affecting the GI tract. So next is drug-induced. Okay, it can be due to drug-induced where malabsorption can occur. It may be due to continuous intake of antibiotics. Okay, it can be due to the intake of antibiotics such as ampicillin and amoxicillin. Okay, it can be due to continuous intake of drugs, that is ampicillin and amoxicillin. So that is usually about this causes of malabsorption syndrome. So causes of malabsorption syndrome, it is usually, these causes are usually different causes. It depends upon different areas. So the first is due to infective agents such as HIV, pancreatic or gallbladder diseases, or in case of lymphatic obstruction. Okay, in case of lymphatic obstruction, or in case of intestinal obstruction. So that is usually there. And next, it can be due to structural defects such as inflammatory bowel disease, in irritable bowel syndrome, or in case of gastrotomy or gastrojejunotomy. And next, it can be due to any mucosal abnormalities. Okay, it can be due to any mucosal abnormalities such as celiac disease, Crohn's disease, or it can be due to fructose malabsorption. Okay, it can be due to celiac disease, Crohn's disease, or due to fructose malabsorption. And next, it is due to enzyme insufficiency. Okay, it can be due to any enzyme insufficiency such as lactose deficiency, sucrose intolerance. Okay, sucrose intolerance. And next, it can be due to pancreatic enzyme insufficiency, and due to any systemic disease that might be diabetes mellitus, hypothyroidism, or it can be due to any celiac disease, or it can be due to cystic fibrosis. Then in case of drug-induced, that is antibiotics, excessive use of antibiotics such as ampicillin and amoxicillin. So these are usually the causes of malabsorption syndrome. So next is symptoms. So we will see what are the symptoms that is usually seen in case of malabsorption syndrome. The symptoms, it can be like they will be having diarrhea. Okay, so that is usually they will be having diarrhea, and it will be chronic diarrhea. Okay, they will be having chronic diarrhea. The stool may contain mucus and pus. Okay, the stools may contain mucus and pus with foul smell. So that is usually they will be having chronic diarrhea. Okay, that is usually they will be having chronic diarrhea, and the stools may usually contain mucus and pus. Okay, the stools usually contain mucus and pus with foul smell. Okay, with foul smell. So that is usually there. And next is they will be having abdominal distension. Okay, next is usually they will be having abdominal distension. Okay, so they will be having abdominal distension. So that is usually there. Next, they will be having continuous flatulence. Okay, that is gas formation. That is usually they will be having continuous flatulence. That is gas release will be there. So that is usually there. Anorexia will be there. Fatigue will be there. They will be having loss of weight, malnutrition, growth failure. So that is usually about, these are the symptoms which is usually seen during this malabsorption syndrome. So what are the symptoms that is usually seen? Chronic diarrhea. Stools may chronic diarrhea. So stools may contain mucus and pus with foul smell. Anorexia will be there. Malnutrition. Malnutrition will be there. Loss of weight will be there. Abdominal distension will be there. Flatulence they will be having, and also growth failure. So these are usually the symptoms that is usually seen. Understood? So mainly symptoms are chronic diarrhea, abdominal distension, flatulence, anorexia, growth failure, malnutrition, loss of weight. So these are usually the symptoms of this malabsorption syndrome. that is usually about this. So next is diagnostic evaluation. So next is usually diagnostic evaluation. We'll see what are the diagnostics that we have to do in order to confirm with this malabsorption syndrome. So what are the diagnosis? So diagnosis, it mainly includes history. Okay, we have to collect history about the illness. Okay, we have to collect history about the illness. So mainly we have to collect the features of stool. Okay, mainly we have to collect the features of stools. Okay, we have to collect the features of stool. That usually is possible, like that is usually required for making diagnosis. Okay, that is usually required for making diagnosis. So that is usually there. And next is usually routine stool examination. Okay, routine stool examination should be done. Then fecal fat studies has to be done. Okay, routine stool examination has to be done. Then fecal fat studies should be done. Then pancreatic function test. Okay, then the next thing that we have to go with it is pancreatic function test. So that is usually done. And then lactose tolerance test should be done, because in the cause I have told that lactose intolerance will be there. So this lactose tolerance test has to be done. Then radiological examination, that is barium meal, should be done. Okay, barium meal should be done to check out for any structural abnormalities. Okay, barium meal X-ray or barium meal study has to be done to check out any structural abnormalities. Okay, to check out any structural abnormalities. So that is usually about this diagnostic evaluation. So diagnostic evaluation that we usually go, it is mainly history has to be collected, like features of stool should be checked to know about the indicate the possible diagnosis. Then we have to go with routine stool examination. Okay, then we have to go with routine stool examination. Then radiological study, that is barium meal study, should be done to know about the structural abnormalities. Lactose tolerance test has to be done. Then pancreatic function test has to be done. So that is usually about this diagnostic evaluation that you do in case of malabsorption syndrome. So next is management. So what are the management that we do in order to reduce this malabsorption syndrome is that, so mainly we have to immediately we have to diagnose the condition, and the underlying condition should be treated immediately. Okay, so mainly we have to diagnose immediately, and the underlying condition should be treated immediately. Okay, it should be treated immediately. So what are the things that we have to do? It is that adequate nutrition should be planned. Okay, adequate nutrition should be planned. It depends upon the cause of the disease. Okay, so adequate nutrition should be planned, and what type of nutrition we have to plan, it depends upon the cause of the disease. So next we have to control the diarrhea. Okay, next we have to control the diarrhea. So the control of the diarrhea I have already discussed about in the diarrheal disease. Like what are the things that we have to do? The same thing we have to do in this also. We have to control the diarrhea. Same management how we have done in the diarrheal disease, the same thing only we have to do in this also. So anyway, you can go through that. So that is usually control of diarrhea. So next we have to give supplementary feeding of vitamins and minerals. Okay, we have to give supplementary feedings of vitamins and minerals, so that we have to check whether they are absorbing it properly or not. So that has to be done. So next we have to maintain electrolyte balance. Okay, next we have to maintain electrolyte balance, because as diarrhea is like chronic diarrhea is there, so they might be dehydrated. That we have to maintain this fluid and electrolyte balance should be maintained. So the normally management we go with giving them therapeutic management. Okay, normally management we go with giving them therapeutic management, where we have to immediately diagnose the condition and we have to treat the underlying cause for the disease. So that is mainly supportive management is given. So what are the things that we do? We just give them adequate nutrition should be planned. Okay, adequate nutrition should be planned depending upon the cause of the disease. Okay, adequate nutrition should be planned depending upon the cause of the disease. And next is usually what happens, we have to control the diarrhea. Okay, we have to take certain measures to control the diarrhea. And next is that we have to give supplementary feedings, that is vitamins and minerals should be given. Then maintain electrolyte balance. Okay, then we have to maintain electrolyte balance. So that is usually about this therapeutic management that we give. Other than that, in case of carbohydrate malabsorption. Okay, in case of carbohydrate malabsorption, so in this condition we have to mucosal enzyme should be given. Okay, in this condition mucosal enzyme for digesting mono and or disaccharides. Okay, mucosal enzyme for digesting mono and disaccharides are congenitally absent. Okay, are congenitally absent. So therefore in such conditions, okay, in such condition we have to exclude glucose and galactose in the diet. Okay, in such condition we have to exclude glucose and galactose in the diet. So in case of carbohydrate metabolism, okay, in case of carbohydrate metabolism, in case of carbohydrate malabsorption, okay, in case of carbohydrate malabsorption, so this occurs because the mucosal enzyme because in this case such as mucosal enzyme for digesting mono and disaccharides, okay, for digesting mono and disaccharides will be absent. So in that case we have to completely avoid glucose and galactose in the diet, okay, we have to completely avoid glucose and galactose in the diet. So next is in case of severe fluid and electrolyte imbalance, we have to give intravenous fluid should be started, okay, intravenous fluid should be started. So this is usually about this management of malabsorption syndrome. So mainly we go with symptomatic supportive therapy, adequate nutrition should be planned, diarrhea should be reduced, intra-fluid should be maintained, balanced, supplementary feeding of vitamin and minerals should be given. Other than that, in case of carbohydrate malabsorption, that mucosal lining enzyme will be absent, so therefore we have to give, completely avoid glucose and galactose in the diet. And in case of fluid and electrolyte imbalance, we have to give intravenous fluid therapy should be given. So this is about this management. So in this class we have studied about malabsorption syndrome. So what is malabsorption syndrome? It is the general term which is used to describe many conditions in which one or two nutrients will not be absorbed properly in the GI tract. So that is usually there, which usually makes the content like it comes out through in the stools as well as along with fecal content. So this is usually seen in the children. So this is usually seen in the children where it is seen in the children where it is not like they are not able to absorb vitamins and minerals, okay, where they are not able to absorb vitamins and minerals. So this is usually causes, or there are different causes for this. So in this usually we saw regarding malabsorption syndrome like symptoms, causes, management, diagnosis, everything. So understood. So this is about this malabsorption syndrome.